Our patient today, he is complaining of 2 months suffer of the stomach issue. Since February, he was complaining of indigestion. Now we are in the oral cavity. This is the mouth. This is the throat. No ulcer here. No ulcer for those who are treating ulcers. Here, this area, you can see bloody red. This is erosion. This is a pre-ulcer condition. You see, this is the importance of the endoscopy. You can discover the cancer in the very early stage.
mu kitundu kyaffe kino ekya endoscopy olunaku olwaleero bulijjo bino tubikunyumiza nga tukugamba bugambi nti waliwo ekyuma kibaita endoscopy kyakukebera nakwekebejja sisitimu eno ey'olubuto eno okuva wano waggulu mu kamwa bwe twogera olubuto olutotandikira wano mu kamwa. So doctor, starting from the mouth, if we are talking about stomach, we start from the mouth, not so? Of course. So, you Dr. Sally nga bulijjo tuwagala kulaba era n'okuwayamu ku process gye tugenda okuba nga tugenda ku tulina omulwadde waffe abadde agoberera ku telefayina ne ku mitimbagano nga tumunyumiza n'okwekennenya enkola ya endoscopy. Nawulira nga obulumi bumususseeko nga bwe twalabula era nga bwe tuze tukulabula kumu ku bubonero bw'omanya nti bweyandyetaaza okuba nga okeberebwa n'otetuma bwetumi nti nyina ulcers. Nga bw'atunnyonnyodde babadde bamugamba nyina typhoid, ndwadde za mu lubuto n'ebirala. Naye alaba nga obulumi bweyongera. Dokita kyeyatugambako nti kasita obulumi bweyongera wiiki emu 2-3 manya nti embeera eyo oba weetaaga okulaba ku mukugu asingayo. Kakati olunaku lwali dokita atugambye nti ayagala tubeere ng'embeera eno tugiraba ffenna tugenda ffenna mu theatre gwe badde bagamba nti ate kaluma nnyo kakola katya. Njagala olunaku olwaleero nawe weerabireko ku process eno. Dokita
Okay, in the name of Allah, the most merciful, the most compassionate, welcome all of you, welcome my team, welcome Stephen, welcome Rose, welcome Robert. This is the endoscopy team. We are in Gombe Medical Service Hospital. Specifically, we are in the GIT endoscopy room, GIT endoscopy unit. Here, now we are happy to help our patients. We are happy to do this unique and diagnostic procedure, which is called upper gastrointestinal tract endoscopy. Our patient today is a 47 years old male coming from outside Kampala. He is complaining of 2 months suffer of the stomach issue. Since February, he was complaining of indigestion. He was complaining of epigastric pain. He was complaining of discomfort during hunger and even after he takes meals. So he has been treated by many colleagues as a case of ulcer. So now he was referred, and we are happy that, and we thank the doctor who referred him for doing this procedure, because as we always telling our junior doctors, please don't keep the patient with you beyond weeks, because this is the cut margin between the acute condition and the chronic condition concerning the stomach issue. Ulcer is not only the disease which affects the stomach. We have many conditions, many diseases, and some of them are benign conditions, some of them are malignant conditions, and always we are looking to rule out malignant condition. It is common at any age nowadays. It is not just a disease of elderly. Okay, so these issues, this man complains, the symptoms, the signs, his condition look benign because he has no weight loss, he has no fever, he has no dizziness, and he has never vomited blood. So we call these symptoms red symptoms. And on examination, there is no red signs. And these red signs, the patient usually become cachexic. Cachexic, that means he has severe weight loss. He has severe disease. So you have to expect what we expect to find. You have to know what is the most likely case of this man. So, because you as a doctor or as an operator, you have to expect what you want, what are you looking for. So, the commonest cause of this type of symptoms, it is hiatus hernia, and it is very common. Hiatus hernia, this term, it is a medical terminology. It means that the mouth of the stomach become wide. Simply like that. I'm talking to the general people. So let us together go into the journey of endoscopy. Welcome. Very well. We tested everything. Okay, dear colleagues, now we are in the oral cavity. This is the mouth. This is the throat. So we have to avoid pushing water in this place because it is going to make the patient to aspirate. So usually we go to the right or to the left of this place, direct to the esophagus. Then you find yourself that now you are inside the esophagus. The esophagus, it is the tube transmitting food from the mouth down to the stomach. So now we are inside the upper part of the esophagus. Now we are doing our examination. So the whole team will observe the screen, not only me. Robert is observing, Rose, she is observing, and Stephen, he is observing. Looking for what? Looking for any abnormal finding. That is the mucosa, that is the blood vessels, that tumors. Anybody who see or saw any abnormal or suspicious area is going to stop. Please, doctor, what is this? Let us observe well. So, according to our experience, up to now, we are safe. This mucosa looks good. It is pinkish in color. And when we say pinkish in color, this is the normal anatomy of the human being. Okay? Lower down, we are moving down. We can see a small white spots. These small white spots reflect infection with fungal infection. These are fungal infection. And as you know, fungal infection, they are type of living organisms affecting this area. Okay, but it is mild. It is not severe. Okay, so let us continue. This is number one. So with the endoscopy now, we find one thing which cannot be seen by any other mean. Okay? Okay, let us continue. What is this area? This area, it is called the gastroesophageal junction. The gastroesophageal junction. It is abbreviated as GEJ area. And it is the mouth of the stomach. This is the junction between the esophagus and the stomach. And this is a very important area. This is a very common area of disease. And usually it is found at about 40 centimeters from the mouth, or specifically from the incisors. So you find zigzag line. This zigzag line, you see, this is the demarcating border between the stomach mucosa and the esophageal mucosa. And this zigzag line is very important because down it is acids, up it is alkaline. So when it migrates up, that means the stomach contents coming up, which is not normal. Okay, and it is a common side of disease. So when you observe here, please try to take time to confirm if there is something called dysplasia. Dysplasia, that means deviation from the normal. Okay, so now we are finished with our gastroesophageal area. Now we are inside the gastric cavity. The gastric cavity, it is the stomach itself. Now, this is the place where people they talk about, I have ulcer, I have ulcer. So now, the examination procedure, we do a general look. Please, my team, Stephen, if you look any abnormality, okay? So generally looking, there is no mass. Always doctors, they are looking for masses. We are afraid of masses because tumors are very common and very serious condition. So now generally looking, there is no mass. Okay. Concerning the wall of the stomach, we have to come very near and very close to the mucosa to examine, looking for acute condition and or chronic condition. So now, what can you see, my people? We can see small red dots, and the redness usually represents acute condition. Okay, so is it confined to one area or it is pan-gastritis? It looks like involving the whole stomach, these red dots. Okay, so I'm going to take a picture with my machine. So this man is having pan-gastritis. You see these red dots. This reflects acute pan-gastritis involving the whole area, down, even here. The area is more red than normal. These red dots. Let us take pictures. We are taking pictures. This area, it is called incisura angularis. This specific area is very common site for ulcers, very common site for tumors, and so on. Now it is clear. Fortunately enough, it is clear. This area of the stomach, it is called the antrum. And here, it is the place where the H. pylori settles. This is the house and the home of H. pylori.
Mwana wattu birabika ng'ebizibu obiwulira naye obaoli awo si bizibu nnyo ng'obituuseemu kati ndabikambulako kimu ndowooza baluwa obaluwa nakufuna lumu wano kwenkola ya consultation ku mbeera ya endoscopy bwetyo betutambudde ekitundu kyaffe kino ekisooso ogenda kunzikiriza tugere tunywemu ku lwendo lw'amazzi then bwe tuba tumaliriza okunywa ku lwendo lw'amazzi tugenda kudda mu kitundu kyaffe ekyokubiri twongere okuba nga tumaliza process eno procedure eno eya endoscopy. Kulikayo nnyo mu kumulamu kwaffe okwo kwe tubaddemu tulaba era atugoberera badde nange sisobola kulinda nga mpya njagala kuddayo tubeere nga tumaliriza enteekateeka eno tugenda kuzuulira ddala omulwadde waffe ayina buzibu ki ekimusumbuwa era tuyinza obutakugamba results just twagadde kulaga bulazi not so doctor we are not going to tell them the results but we just want to show them the procedure, the process. So tugenda kulaga bulazi process nga bwetambula tetujja kuwa results za mulwadde kubanga ekyo tekikkirizibwa n'ekyo tusinga okuba nga twagala okuba nti gwe omusawo asookerwako junior doctor togamba mulwadde kitamuluma tolemera ku mulwadde kumutegeeza nti kino na kino na kino na kino olwokuba owulira nti ulcers ziba mu lubuto buli kimuluma olubuto lumuluma afunyemu embiro afunyemu okutanaka gwe mugambe nti izo ulcers no toyinza kumanya nti izo ulcers nga tokoze test ya endoscopy doctor kyakugamba gwe kola obugwo mulwadde ono beera naye weekend eyokubiri ekinene ennyo kasazibwera weeks 3 ng'olaba obubonero bwebwo doctor akugambye nti muleete ajje ku process eno procedure eno ya endoscopy katuddeyo mutundutundu yaffe lino twongere okuba nga tulaba ate ebintu nga bwe bitambula.
So now we got close to the wall, looking by side for signs of H. pylori infection. There is no signs of H. pylori infection. We know if there are many ups and downs, that means these are macroscopic features of H. pylori. There are no any macroscopic features of H. pylori. What is this opening, Rose? This is the pyloric area, which is the gastric outlet. We have to go quickly because it usually closes. Okay, now where are we now? Please, we are in the first part of what? Of the duodenum. This is the first part of the duodenum. Now we are outside the stomach. Now we are outside the stomach from the other end. Yes, like this. So where are we now? What is this lump, Rose? This is the ampulla. This is a normal structure found in the human being. This is the place from where the bile comes ejected out of the bile duct and bile space. Okay, so now this is the second part of the duodenum, and it looks a little bit inflamed, but it is normal. A little bit inflamed, but it is normal. Okay, we are going to push some air to open. You see the contraction. This is a normal contraction. Okay, we have to examine carefully. No, we are not in hurry. We are going down. We are going down. We are going down. Looking for tumors, ulcers. Okay, no ulcer here. No ulcer for those who are treating ulcers for non-ulcer diseases. This is the second part of the duodenum. We are happy this patient has no tumor, has no serious disease. Now we are done with this area. We are going back. Okay. For me, no need to take any biopsy. No need to take sample because everything is clear clinically like this. And this is one of the characteristics and the abilities of the machine to take a biopsy, tissue biopsy. So no need to take a biopsy. We are going back. Even while we are going back, we are examining. We are examining. What is here? So Rose, she's not happy with this area. My colleague now, she's not happy with this area. So we have to have a time looking for this area. It is a pre-ulcer condition. This is a pre-ulcer condition in the junction between the first and second part of the duodenum. Okay. Again, we have to have a look until we are convinced that everything is good. Okay. Because this is the area which is not normal. Okay. The pre-ulcer condition. I'm going to have a picture. Okay. Do you think that we need to take a biopsy? Please, the team have the right to say any opinion. Okay, we take biopsy. Let us, when you suspect, please take. It is better to come back as normal rather than to miss an important diagnosis. Now, bring me the force. While we are preparing the biopsy, I can just examine another area, for example, outside, until they prepare the biopsy forceps. Then I come back. I need somebody to cut here very tightly. Fix, yes, don't leave it move. Now we are putting, this is the forceps biopsy. Please open. Now it is open. And close. Okay, we are going inside. Meanwhile, you are going to see this wire inside the stomach. We are waiting for the tube to appear in the screen. Down, 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 down. Yes, can you see this? It is here. So now we are pointing to the open. Take. Now we are taking a biopsy powerfully. Let me clean the area. I'm going to take pictures. This you can. I am controlling the biopsy forceps. We are taking a tissue biopsy. Okay, so now already we have done. The cells of this area looks abnormal. It is not. This is
so you are trying to see what is the problem.
Yes, it could be early cancer.
Oh.
You see, this is the importance of the endoscopy. You can discover the cancer in the very early stage. Okay, so we took a biopsy. The people in the lab, they are going to give out the result as is it an inflammation, infection, early cancer. Okay,
so that is a sample. You have taken a sample. Okay,
we call it tissue sample.
This is sample.
Tissue sample. Okay, and this is a final diagnosis. What will come back will be final. You don't need to do any scan, anything. It will be a final diagnosis, and this is the characteristic of the endoscopy machine. So now we are moving to the another stage of endoscopy, examining. We are going to see the stomach from down upwards. This maneuver is called J maneuver. You see now, we are looking to to the space of the stomach from downwards upwards. And even you can see the scope coming from the mouth of the stomach. Where are we now? Now we are in the lower part of the stomach, looking to the stomach from down upwards. This is complementary part of endoscopy examination, because unless you do this maneuver, you cannot see the roof of the stomach. Now we are looking to the roof of the stomach. We are going very near. Let us come near. Robert, what can you see? What is here? Here, this area, you can see bloody red. This is erosion. This is a pre-ulcer condition, because these areas are just like esophagus, very near to each other. When they collaborate together, they are going to form big ulcer. But still, it is a pre-ulcer condition. But it is a serious pre-ulcer condition. So that means the stage before being full ulcer.
Okay, it doesn't worry so much.
It doesn't worry, but it is painful.
Okay,
and it is important to know this. So I'm going to take pictures, and that is what we have been talking about. This patient, most likely he has something in the middle.
The pain.
This is the cause of pain. When he is hungry, this area is painful because the acid secretion of the stomach is going to contact this bare area and causing pain. Number two, when he eats any meal, the food is just going to stuck in this area, and at the same again it is painful. So this is the erosion.
Does that part come into contact with the food or?
Yes.
Okay.
Yes, this is the stomach. When you eat anything or drink anything, it just will come in touch of this area. So now we know what is wrong with this patient. He has erosion. Not ulcer. Erosion.
That is the first
stage. The stage before forming full ulcer.
Oh.
Okay.
Yes. And
the people, they have to know this. A stage of
erosion.
It is a stage before being full ulcer. But it is a serious. You can't see how bad looking. Yeah,
it looks bad.
It looks bad. How can you know this without doing endoscopy?
You can't.
It is impossible.
You can't.
So this is erosion. The diagnosis is gastric erosion. Gastric erosion is a stage before forming full ulcer. You got the point?
Yes.
I'm going to examine for hiatus hernia. I think you have heard about this term, hiatus hernia, okay? So this is the right time to look for the hiatus hernia. Hiatus hernia is found in this place. Rose, this man, do he has hernia or not? He has. This is space between the scope, between the tube, and between the gastric wall. This is space is called hernia.
Hernia.
Yes.
Oh.
This is not a normal finding in a normal person. For the normal person, the mucosa and the wall of the stomach will be very close and tight to the tube.
Okay.
When you find this space, it is just like a hole.
A gap.
A gap. This is what we call it a hernia.
Nga tonneewa ddagala, tonnanywa budomola, tonnaba kukolokota bintuntu kugamba nti kambiteeke mu lubuto bangamba biwonya ulcers. Omulimu gw'olina guli ogwo kulaba Digestive Fine bunaku olw'Essande bannaffe abagoma Medical Services Hospital beewaayo okukusomesa wejjanjaba otya ulcers ng'omaze okutegeera nti ddala ozirina, so si kuwulira bikuluma mu lubuto n'otandika kubanga onywa biddagala nakwekapika biddagaladagala ojja kumala akaseera nga n'ekintu kyali kyangu nnyo kyakumanya bw'oyimiridde olaba Digestive Fine n'ogenda ku Goma Medical Services Hospital ne bakukebera ne bakwekebejja ku kyuma kye bayita endoscopy.